This is Core Conversations with Natalie Baggio.
Welcome to our newest episode of Core Conversations. I'm team member Sarah Cavanaugh, and once again, we're flipping the mic on President of Corewell Health in Southwest Michigan, Natalie Baggio. Welcome, Natalie.
Thank you. This is a great experience to have me in the seat where all the questions are being asked. So
Good.
I'm looking forward to this episode.
I'm glad, but don't worry, you'll be back here very soon because this is the kickoff of Series 3 here at Core Conversations, in which the topic is really about the career pathways for our care teams here in Southwest Michigan. So, Natalie, do you want to speak what you mean by that, the career pathways? The career pipeline programs, when you say something like that, what does that mean?
So it means that we have organized and worked with community partners to develop seamless pathways for some of our team members or community members to work through the process of choosing a career in healthcare.
Oh, okay. Very cool. So what we're hearing is that in general, healthcare workforce shortages are a national trend. So what is happening? So are the things that you're describing what you think will help solve for that here in Southwest Michigan?
Absolutely. And things that you hear nationally are around like nursing shortages.
Yeah.
And some of the numbers that you hear where we're going to be in the next 10 to 15 years are staggering and concerning.
Mm-hmm.
Also for physicians, because there's people not choosing to become physicians as frequently as they have in the past. But it goes beyond nurses and doctors. It's through healthcare in general. And we've seen this shift most recently post-pandemic, where there's a lot of different options out there and people want different work-life experiences. But being a healthcare professional, being connected to what we're doing here in Southwest Michigan specifically, but how to take care of patients. There's a lot of people who are connected to that work and feel that same purpose. And I'm optimistic that by us having these types of programs, we're going to connect a lot of people back to choosing a career in healthcare. And we've already been very successful over the last 3 years.
Okay, well, this is great to hear. I hope that it's reassuring to folks that there is a plan. You have a plan to make sure that we're in good shape here. We were also talking before the podcast even started about the gem that is Benton Harbor, St. Joe, Southwest Michigan, and, really wanting to know or talk about how to show people how attractive this lifestyle is, this location is, and then also the quality of care that is so close to home compared to other cities, even larger metropolitan cities. Can you talk a little bit about how that's an attractive piece as you can continue to recruit?
I don't think we have to tell people who've lived here how beautiful it is.
True
and
enough.
How nice it is to live here. It's the people that we're recruiting here. And I'll share about our residency programs.
Okay.
We have internal medicine, family medicine, emergency medicine. And out of those groups, when they have an option to go look for a job somewhere else, we retain over 30% of them here in Southwest Michigan because they love the lifestyle and the experience. And, being a person who relocated here 9 years ago,
Mm-hmm.
I've just fallen in love and been enamored with the outdoor activities, the beauty of the water, the lake and the rivers are gorgeous here. Being able to hike, it's walkable. I mean, if you love being outdoors, you instantly feel connected to it. And we have some beautiful golf courses as well.
Okay, you're selling me. I live in Grand Rapids, but I'm like, I got to come back here next weekend.
Yes.
Okay, so if these efforts that you're talking about succeed, what can the community, how do you see this looking 10 years from now here in the community?
Well, let me share with you how it's impacted us in the first 3 years.
Okay.
So we've built stronger connections with community partners to enhance the experience for our team members and our community members to choose a career in healthcare. But what we've seen, over 200 people have gone through the 7 programs that we have in place today. And what that has done to keep care local has decreased our open positions and our vacancy rate and has decreased our turnover rate. So more people are staying longer and there's less open positions to where we're bringing in agency staff or locum staff, and that's good for the community.
That's right.
And our part of our mission and our goal is to continue to grow access to healthcare here locally and be able to have more bricks and mortar to where care's more in people's communities. So people aren't even traveling across Southwest Michigan. So not only will we be able to increase the number of people we're going to have less openings and people are going to stay longer.
I mean, this sounds very reassuring to me, and I hope that folks who hear this find it very reassuring. And then in moving ahead, thinking about future podcasts where you're back in the chair, I will give it up. You're going to have some guests coming that have actually done this, right?
Yeah, through my series 3, I'm going to be talking to people who've actually experienced and gone through the pipeline programs and have chosen a career in healthcare. So some of them have really great stories, how the pipelines have given them an opportunity they haven't had in the past, have helped fulfill their dreams, but have also helped inspire them to be in healthcare.
That's amazing. Thank you, Natalie, for being our guest on this episode of Core Conversations.